Hello, everyone, and thank you for joining our webinar today on the next normal in health. My name is Darren Sabo, and I'll be leading our session today along with my colleague Guillaume Payan, who will be helping us answer audience questions later in the session. Before we get started, let me just set the scene. Our session today is part of a 20-webinar series called Business Resilience in All Times that Orange is organizing to provide information and thought leadership to support business leaders throughout the COVID-19 pandemic and beyond. Today's session is a look into the domain of health in the next normal. Our goal is to provide a Silicon Valley perspective on the major societal changes we expect to see in the digitally accelerated world after the pandemic. Just a little background on Orange Silicon Valley. Our office has been participating in the Silicon Valley ecosystem now for about 20 years through investments, strategy, and technology innovation, with a team of 45 subject matter experts focusing on 17 areas of technology innovation, including smart cities, connected cars, artificial intelligence, digital health, and more. As for myself, I'm Darren Sabo, a principal here at Orange Silicon Valley, focusing on emerging markets and in particular, how we can leverage programs and partnerships to build a bridge between the Silicon Valley ecosystem and Africa and the Middle East. This touches a variety of industries, including rural connectivity, agriculture, financial services, education, and health, which brings us here today. We're thrilled to be joined by two excellent guest speakers, Trudy Schrute, who leads industry initiatives for Blue Shield of California, and Russ Glass, who's CEO of Ginger, a startup based right here in San Francisco that's tackling remote delivery of mental health. The general structure of today's webinar is simple. We're just finishing up with our introduction, and I'm about to start with a brief health industry overview to set us up for the main part of our session, which is the 30-minute fireside chat with our guests, where we'll be integrating audience questions as well. So please enter any questions that you might have in the chat or questions box that you see on your screen, and my colleague Guillaume will collect them throughout the session for our fireside chat later on. So let's get started. Dr. Mike Bryan, who's executive director of WHO's Health Emergencies Program, stated last week that in our current situation, it's very unlikely that we can eradicate or eliminate this virus. Now, until a vaccine is produced and distributed, which, realistically won't be for at least another 12 to 18 months, we're going to have to learn to live with it. Certainly, this is the case here in the US, where new COVID-19 cases just continue to rise and rise. As of yesterday, the 7-day moving average was now up to about 62,000 cases. There's really no end in sight for the time being. And this isn't only having an effect on the general public. Healthcare workers are at an increased risk, not only physically, but psychologically as well. According to research from Mount Sinai Hospital, they're estimating that up to 40% of healthcare workers and first responders will experience PTSD because of the COVID-19 pandemic. They use first responder data from the 9/11 tragedy in New York City as a proxy to come up with those estimates. And early data from China and Singapore seem to be supporting an increase of stress and anxiety in healthcare workers. Additionally, a new report from the physician search firm Merritt Hawkins found that 18% of physicians across the US plan to either retire, temporarily close their practices, or opt out of patient care completely due to the COVID-19 pandemic. We really can't underestimate the long-term effects this crisis is going to have on the health system workforce globally. Because of these extreme challenges, we're seeing some non-traditional partnerships emerge to assist the healthcare industry. For instance, let's just take a look at car manufacturers. Tesla reopened their New York production facility for Medtronic to make ventilator devices and components. GM announced a similar partnership with Ventec Life Systems for ventilator production at their Indiana facility, and Ford teamed up with 3M and Thermo Fisher to manufacture much needed medical devices as well. This is really a win-win scenario for both sides, since auto factories were under capacity and there was a shortage of ventilators and other critical medical devices to help treat patients across the country. Large retailers are responding as well. Walmart says it's looking beyond traditional retail health clinics to create healthcare supercenters with comprehensive healthcare services. Last month, it opened 2 additional health centers, bringing the current total of 4. They're more like one-stop shop for healthcare, with primary care, urgent care, diagnostics, behavioral, and dental all under one roof. As for Walgreens, it's no secret that they've been struggling as a result of the pandemic. which is no doubt related to the broader decline of brick and mortar retail, due to widespread shutdowns across the country. The company announced a loss of $1.7 billion in the last quarter. Now that's compared to a $1 billion profit during the same period in 2019. Despite this, however, they announced that they'll be investing $1 billion over the next 3 years to open up to 700 stores with health clinics in partnership with VillageMD. CVS, the retail chain that acquired Aetna Insurance back in 2018, announced that it's planning to open 1,500 health hub clinics by 2021, all without doctors. The company is currently piloting these health hub locations, which offer a broader range of healthcare services, digital tools, on-demand health clinics. With this new format, over 20% of these stores are now going to be dedicated to health services. And then when we look online, Amazon's ramping up their Amazon Pharmacy offering, really capitalizing on that 2018 acquisition of PillPack for $753 million. Actually, just the other week, they launched a free PillPack service that bundles, organizes, and delivers customers' prescriptions, their medications, vitamins, supplements, all in little packs that are delivered right to their front door. In terms of other big tech involvement in health, Google and Apple partnered on contact tracing, developing an opt-in smartphone app that exchanges anonymized codes between mobile devices via Bluetooth once two people have been near each other for at least 5 minutes. If someone with the app is diagnosed with COVID-19, they can upload all of their random codes to a database, which other apps can then check against to see if that person's been exposed to a COVID-19 carrier. Now, this approach protects user privacy since there's no exchange of PII or personally identifiable information. However, it obviously has limitations since there may not be enough people opting into the service. Now, this is very different from the approach that China took, where the government deployed a mandatory mobile app that tracks a person's activity along with their national identity number, their phone number, all stored in a centralized government database. Separately, Google has also teamed up with Amazon and Microsoft to join the COVID-19 High Performance Computing Consortium, led by the White House Office of Science and Technology, Department of Energy, and IBM to provide bioinformatics and epidemiology researchers with enough computing power to really supercharge the computational research programs related to COVID-19. On the digital health startup front, there's also been good news. We're seeing a renewed focus in investment in new technologies from the venture community. Raquel just reported that funding in the first half of this year has outpaced that of previous years by quite a significant margin. Also take note that the total investment was $7.4 billion in 2019. That was actually down from 8.2 the year prior. However, if we keep up the current pace, 2020 is on track to be the biggest investment year so far for digital health, attracting a total of $5.4 billion as of just a few weeks ago. Now, a lot of this is being driven by larger, later stage rounds for already established companies, fueled by investors seeking more stability. However, seed and Series A still made up about half of all investments, albeit a smaller proportion compared to previous years. The top 3 rounds, you're looking at ClassPass, which raised $285 million in their Series A round. They originally focused on flexible gym memberships, but quickly pivoted to offer a catalog of pre-recorded classes to enable partners to host virtual classes. Then you have Alto Pharmacy, who provides full-service digital pharmacy. They raised $250 million in their Series D round, and Amwell raised $194 million in May to meet the increasing demand for telehealth services, which we'll talk a little bit more about in just a minute. Digging a bit deeper into the numbers, startups focused on services that enable healthcare providers to deliver care remotely were most attractive to investors. Digital health startups providing on-demand healthcare, such as Amwell and Alto Pharmacy, raised $1.1 billion in the first half of the year, while firms focused on disease monitoring raised a total of $831 million, putting each category on pace to double their 2019 totals. In the first half of 2020, telemedicine companies, which enable either synchronous or asynchronous virtual care, raised a total of $926 million. Now, to focus on telemedicine for a minute, the sector is really booming. Physicians are changing the patterns of their practice because of the COVID-19 pandemic, with 63% of hospitals and health systems now using telehealth to treat patients, up from 20% during the prior year. I don't mean to state the obvious here, but That's a threefold increase in utilization. Some healthcare systems are reporting that 80 to 90% of their visits have transitioned just to telehealth. To illustrate this point, UC San Diego Health, they have a virtual visit platform that had seen somewhere around 800 visits over the past 3 years combined. They soared past that mark in 2 days alone during the pandemic. Meanwhile, FCC announced the second round of recipients in its $200 million telehealth program, awarding $3.7 million in grants to aid COVID-19 telehealth deployment to 5 healthcare organizations across the country. If you recall, this is a carve out from the $2 trillion CARES Act that Congress passed back in March. Another supporting action was a move by the Centers for Medicare and Medicaid, which temporarily suspended intrastate rules around telehealth, not only allowing care across state lines, but also allowing physicians to care for patients at rural hospitals without having to be physically present. Previously, rules like this have stalled telehealth adoption and reimbursement, but now that the proverbial leash is off, the industry is accelerating quite rapidly. This trend isn't limited to just medical visits. It extends to in-home fitness as well. Peloton, a company that makes smart connected stationary bikes and treadmills, reported a 66% sales bump in the latest quarter. Keep in mind these devices aren't cheap either. Peloton's stationary bike will set you back $2,300 in addition to a $39 a month membership subscription to access their virtual workouts. Also, the fitness display company Mirror was recently acquired by apparel manufacturer Lululemon Athletica for $500 million. For $1,500 plus $39 a month subscription, this company provides you with essentially a vertical TV screen that displays workout videos and doubles as a mirror when not in use. There's another company based right here in San Francisco called Tonal that has a similar value proposition, but it's connected to a series of tension cables that automatically adjust to your personalized workout routine. Analysts say that even if gyms do reopen, these companies are still very well positioned for the future, as new social distancing norms and uncertain gym policies may continue to keep customers at home. Additional physical gym chains such as 24 Hour Fitness and Gold's Gym either declared bankruptcy or they're considering it. As for at-home medical devices that enable remote monitoring, technology company Lenovo announced the launch of Lenovo Virtual Care, a remote monitoring solution released in partnership with the software company Vianova Health, allowing patients to access personalized care plans on their Lenovo devices. It connects biometric devices and utilizes an AI-based virtual assistant, which they're naming Rosie. They expect this service to launch in the second half of this year. Also, startups such as Kinsa, which produces a smart thermometer, created the Health Weather Map, which gathers fever data by zip code across the country and determines potential COVID-19 outbreaks based on differences from historical trends. So this is an example of using data from connected devices for predictive modeling of infectious diseases, which could also be helpful in the post-COVID-19 world. Mental health is also coming to the forefront and becoming a critical part of the digital health ecosystem. Today, 1 in 5 people in the US have a diagnosable mental illness, and unfortunately, 60% of Americans go undiagnosed, therefore never seek mental health treatment. The advent of COVID-19 has just exacerbated this issue. According to data from a recent Kaiser Family Foundation poll, 47% of adults say that stress related to COVID-19 shelter-in-place orders have had a negative impact on their mental health, significantly higher than the 37% reported by those who are not sheltering in place. Health tech companies responding to these mental health challenges are varied, with their approaches ranging from CCBT, which is computerized cognitive behavioral therapy, demonstrated by companies you may have heard of such as Headspace and Calm. Then there are connected hardware companies such as Ybrain or Neuroflow, which use smart wristband or VR headset to deliver therapy. And then, of course, we have telepsychiatry companies, which build a remote bridge between therapists and patients. This category consists of companies such as Lyra and Ginger, whose CEO we'll hear from in just a few minutes. As we address in our webinar session on education, the pandemic is actually changing the way we think as well, at the biological level, making it more challenging to concentrate and work. This is because the longer we're in this constant state of stress, the more the survival part of our brain develops and the higher order thinking part of our brain literally atrophies. Mitigation strategies to avoid this include creating a predictable routine, getting a good night's sleep, staying organized, and having access to professional psychological help early in the process. And fortunately, more and more people are seeking out mental health help online. While Google searches for mental health services near me have been steadily increasing over the past few years, searches for virtual mental health saw a sharp spike at the onset of the pandemic, indicating a recognized public need for these services. And to talk about these trends and more, I'd like to transition to the fireside chat portion of our session. We're thrilled to have Trudy and Russ joining us. They're two amazingly talented guests sharing their perspectives from both the payer and provider side of the healthcare industry. As for our format, I have some questions prepared, and my colleague Guillaume will be actively monitoring the chat and questions tab on your screen for audience questions. So please don't hesitate to enter them as we go. And some background on our guests. First, we have Trudy Schrute, who's a long-term healthcare innovation advocate. She recently left Kaiser Permanente's venture capital fund, where she led strategic engagement and served as a conduit between Kaiser Permanente and earlier stage innovative startups. In her new role at Blue Shield of California, Trudy will be leading industry initiatives for the organization with a focus on innovation policy. Trudy is also on the board for the Family Caregiver Alliance and is an advisor for Endwell. She received her BA from UCLA and a master's in public health from UC Berkeley. Go Bears. And we also have Russ Glass with us. Russ is currently CEO at Ginger, which we'll hear more about in just a minute. Prior to joining the company, he led products for the marketing solutions group at LinkedIn. He's also the founder and former CEO of Bizzo, a B2B marketing and data platform, which was sold to LinkedIn back in 2014. Russ has a Bachelor of Science in Engineering and Mechanical Engineering and Economics from Duke University. He's also author of the children's book, Voting with a Porpoise, and serves on the board of Rock the Vote, an organization that seeks to increase voter turnout amongst younger voters. So to get things started, why don't we kick things off by hearing a little bit more about your backgrounds, your organization, and your current role. Trudy, why don't you lead things off for us, then we'll hear from Russ.
Yeah, that sounds great. I'm so excited to be here. Thank you for having me. I am definitely, as you mentioned, Darren, in an interesting transition right now because a week ago left Kaiser Permanente's venture capital fund and joining Blue Shield. But just to orient folks to who I am, I have worked at several levels within healthcare. Started as a frontline health educator in medically underserved communities, went on to run national quality programs that impact millions in home health, hospice, home-based palliative care. So really vulnerable populations and in their homes. Went to early stage startup to actually build products that met unmet needs, and then went to the venture fund. And what I think is I was in a very unique opportunity where I was at one of the largest integrated healthcare systems and really got to see these really cutting edge innovations, supporting them being adopted by operations, and the impact there, 12.5 million members KP has. And now I'm transitioning into innovation policy because as I've worked in all of these roles, the biggest barrier to scale for innovation adoption tends to be regulatory and policy. And we've certainly seen that with telehealth and so on right now, which we'll talk about. But that's sort of my focus going. And I'm so excited to see Russ because Ginger was a KPV portfolio company and I got to work a lot with him. So happy to be here.
Thanks.
Trudy is the best. Thanks so much for having me. Also thrilled to be here to talk about this. I think it's obviously incredibly important. It was really important pre-COVID, and now it is even more important. I'm a multiple-time entrepreneur, as you see. I've done a lot of varied things. I tend to follow passions and interests and just execute against what I think is fun and exciting. And as I left LinkedIn, I realized that I wanted to do something in the world that needed to exist, that was truly impactful and could help people. And as I was in that discovery process, I started to get connected with Ginger and recognized the huge problem that Ginger was trying to solve, which is that we have this supply-demand imbalance in the mental health space, with far more people who need mental health care. This is pre-COVID. Far more people who need mental health care, skyrocketing anxiety rates, depression rates, suicidality rates. And on the other side, not enough providers, or even close to enough providers, to support that need today, and shrinking over time. So you have these divergent curves, you have this huge need, and now, of course, COVID hits. Ginger's approach to this as an on-demand behavioral health system is to have an end-to-end, entirely virtual, scalable system to deliver care. We start with behavioral health coaches that are accessible 24/7 via chat. We bring content in, CCBT, as you mentioned before, and we work with people all the way from preventative care to more serious levels of care, where we escalate those people to our therapists and psychiatrists when that extra care is needed. Big difference, though, is we don't refer them out, as you might see in other systems. We bring those people into the care team. So now you might have a coach and a coach, therapist, and a psychiatrist if medication management's needed. And we can deliver this care in all 50 states from the comfort of your home. And that is really what Ginger is trying to scale, to change the way mental health care is accessed and delivered.
Excellent. That leads us perfectly into our first question around telehealth and adoption. So we saw earlier that other telehealth providers are seeing spikes in adoption rates. Could you tell us a little bit more about the rise in adoption that you've seen at Ginger, and maybe Shruti, maybe you could comment on how you've seen the rise in telehealth really impacting healthcare delivery more in general, even beyond just mental health.
This is an interesting one. I would say that, telehealth's been around for quite a while. Some of the first telehealth services from the VA were in the early 90s for telepsychiatry. So it's been around for a while, and yet adoption had been relatively slow. Mm-hmm. When people did adopt, when they did either pick up the phone to access care that way or access it through video, it tends to be very sticky, because people realize that it was wildly convenient to access a doctor or access a therapist via those digital means. But adoption rates were low. What's happened in this last period is 2 to 3 years of acceleration of adoption rate at a minimum. And COVID has driven friction in the in-person process. You don't want to go to a doctor. Mm-hmm. You don't want to be exposed to COVID. You still have a need, in fact, in the mental health world, an increasing need for care. And Ginger has experienced over 200% increase in clinical need. So in our clinical sessions on a post-COVID period from a pre-COVID period, we've seen close to 100% increase in our daily actives in that same period, so people showing up. And we're also seeing intensity go up. So as part of our supply-demand management, we measure the intensity of conversation. Mm-hmm. And on a 1 to 5 scale, our providers will say, how intense is this? And that's gone from pre-COVID in the mid to high 2s to the mid 3s during this period of time. So more intensity, much more use, and more clinical need during this period.
Yeah, I mean, definitely agree with Russ there. Like, I think for folks who are working in the innovation ecosystem, telehealth, has been the vision, right, for years before the pandemic. Mm-hmm. And you had companies like Ginger building solutions. You had pockets of really excellent innovation on the payer provider system side. And then you had venture capitalists investing in this space, for years now. And it has been incredible to watch the acceleration. And I would even say it's like the work in systems, the infrastructures that have been built were on the roadmap, like the 5-year, 7-year roadmap that were done literally in months. There was a national study for physicians, and essentially the adoption rates for telehealth went from 22% to 85%. So 22% in 2019 to 85% currently in 2020. Also, you hear these stats coming out from the payer side of the house. One stat that really stood out to me was Cigna, their commercial members. It grew 28 times. So that when you see those numbers, the data is following, and there's tons of studies out there from lots of different folks.
Mm-hmm.
But then on the care delivery side, you definitely, I mean, you see it, right? Like anybody who is has a health plan membership, right? You've been getting communication from your provider about how to utilize systems, new telehealth sort of options.
Mm-hmm.
And so I just say that, yes, rise in adoption, for those that were leaning into innovation, that's been the case for telehealth for a while, but now it's here to stay, I think.
So actually, let's stay on this for a second. So we're talking about the convenience factor of telehealth and the necessity of telehealth because you just can't see your primary care doctor right now because to stay at home. So what other benefits do you see telehealth providing versus in-person care? And what I'm getting at here is what's the ability, like what do you see is the possibility for telehealth to really just be healthcare in the next normal after the pandemic, instead of just going back to in-person services? We're seeing similar patterns in like education delivery and things like that. So,
I mean, one of the biggest, I think, benefits of telehealth is scarce resource, right? Scaling scarce resource. And we certainly see that in Ginger. So would love to hear more, Russ, from you about that with mental health specifically. So I won't touch on that, but like things like genetic counselors, with services like 23andMe, and the demand for services has gone up extremely, but the increase in genetic counselors has only been 2% over the last few years. And so when you look at and that's just one example, but when you look at the country, almost everyone is struggling with providing these services. And you have companies like Genome Medical out there who are using telehealth to basically scale these resources. So aside from convenience factor, there's that. There's also quality outcomes, which I know Russ can also speak to with Ginger, so I won't touch that. But it's not really just convenience. And right, like I think the two biggest barriers for why the acceleration, so we had the two barriers of regulation and also adoption rates from consumers and physicians before the pandemic. And then, a fire sort of happened and people had to move and accelerate this. And those two things were no longer barriers. I think it's a new normal moving out of the pandemic in that telehealth will no longer be a delighter or differentiator. It's just a core practice. And so what we're going to see, I think, is moving from, right, you have like asynchronous, synchronous, like remote and sort of care navigation buckets. And then you have clinician to clinician, clinician to patient, and then patient to technology, right? And you're going to see sophistication of what those things look like, the evolution from episodic care to continuous care, the evolution from just my doctor to any doctor on demand, things like that. But Russell, I know you have some great examples of all of these things.
I think everything you mentioned is exactly right. I mean, I would say, first of all, Ginger made a decision as a company trying to solve supply-demand imbalance. We made a decision from the start that you had to be virtual. So that's telling on one of the advantages of virtual care, which is far more scalable. You don't need brick and mortar stores, storefronts. You don't have to spend money on that. You don't have to build those up, is one. Two is you are able to be far more efficient in your delivery of care. Virtual can go from one person to the next, literally like this. And that waiting time, that time between members and patients, is important in a supply-demand imbalanced world. Three is measurement-based care is far easier in the virtual world than it is in the real world. We're measuring how people are doing over time. We're monitoring their speech patterns in order to be able to say, this person has a 50% higher suicide risk than they did prior. We are able to make sure quality assurance is higher. because we are able to personalize care based on all of these conversations we've seen in the past. So there's all this additional capability. In the mental health space, it turns out just measuring, even if you don't do anything with the data, just measuring improves care 20 to 60%, or outcomes 20 to 60%. So it's cheaper, it's far more scalable, and it leads to better outcomes. You can't manage everybody this way. So it turns out 5% of the population is going to need to have an in-person or inpatient treatment in mental health specifically. Obviously, in physical health, there are going to be other needs for inpatient treatment, but the vast majority of healthcare can happen virtually, which will pull all kinds of costs out of the system and can add quality metrics that just didn't exist before.
Talking about measurement and metrics, you spoke a little bit about some of the data that you're collecting on the patient engagements. How are you using that on the back end, and what sort of tools are you using to do analytics? I know Ginger has a background in machine learning, and I know there's a lot of advanced analytics that you're doing in the background. Could you tell us a little bit more about that?
Sure. So first of all, we're using that for care. So we're collecting measures that are standard measures for mental health. So the PHQ and the GAD to measure depression and anxiety. We're collecting information about mood. So how are you feeling now? How are you feeling in checkpoints over time? We're collecting self-reported information about how did you think this session went, which is actually very predictive in terms of how someone feels about something. And that allows us to both maintain quality of provider as well as ensure people are going in the right direction. We're monitoring chat and extracting NLP information, or natural language processing information. Features like comorbidities, background, history, family history, medication someone has taken in the past, tone of voice, how is somebody trending over time? And we're using that to make predictions. What is next best action? What is the right way to think about this person's risk profile? So is this person getting more and more suicidal or homicidal in terms of intent? Is this person getting better over time and we can step them down on their care platform versus stepping them up, even all the way to emergency services if needed? So we're using this information to improve care, but importantly, we're then taking this information in an anonymous way, so de-identified, and putting it back into our algorithm so we're improving over time. So in theory, every session we give is leading to better outcomes in future sessions. And that's how we're going to continue to scale and be efficient over time.
One thing I want to add too, which I love this about Ginger, I was pretty close to the KP Washington partnership with Ginger. And of course, they've scaled since then across KP. But KP Washington had thousands of mental health and wellness providers that they were contracting with. Some of them were standalone sort of folks. Some of them were bigger practices. Ginger, out of the thousands, was the only provider they were contracting with that was giving them any data back. And in part, they were basing their contract with Ginger on the outcomes. So it was in part value-based, which is amazing. That's really such an, I think, the model that we all should be striving for, value-based. And the fact that Ginger is able to provide that data when others were not is pretty incredible.
Thanks for that. So actually now I want to ping my colleague Guillaume just to check in to see if we have any questions coming in from the audience.
Oh,
good morning.
Good morning, guys.
Team. Thank you.
Yeah, great session. It's super interesting. So we do have indeed a few questions. One of them is specifically for Russ and Ginger. So the question about like, what are your plans outside the US? And also, you described a little bit about it. How do you protect personal health information locally and internationally? So how do you comply to local laws?
Sure. So first of all, we are already providing our services in 25 countries around the world. In effect, we have a lot of large enterprises that are using our services, and they have employees everywhere. And so we will go in country, understand local regulations, determine if we're a fit with those regulations, or can we comply with those regulations relatively easily. And if so, we'll move forward. Some examples of countries that we're in: the vast majority of Western Europe, a number of states in Latin America, a number of countries in APAC, and US and Canada, obviously. In terms of information protection, we're a hospital system in effect. So we follow the HIPAA regulatory environment here in the United States. Because it's hard to change sort of regulatory regime from country to country, we end up following the most strict regime we operate in. So whoever has the most strict healthcare policies, we are at least as strict as the most strict country, and we just follow that across all of our different countries that we operate in. And we're quite advanced in terms of how we're protecting healthcare information, and getting even more so, borrowing from some of the best practices in all industries, moving towards things like distributed platforms to make sure that if you do have any sort of data breach that happens, you can minimize the scale of those data breaches. You can minimize zero trust architectures, for example, to make sure that you're not going to put that PHI at risk.
Actually, I'd like to just switch gears a little bit and talk about what you see employers doing to help their employees, both on the corporate side, but also healthcare workers. So actually, why don't we talk a little bit about the healthcare workers first, and then we could hear from Russ about what he's seeing on the corporate side of things.
Yeah, I think so. One, I think Russ can also speak a lot to this because they're supporting a lot of healthcare workers. But I think that there have been a lot of interesting, innovative partnerships around mental health and wellness for healthcare workers. You've seen big announcements coming out of folks like Cigna expanding Talkspace partnership, KP expanding their partnership with Ginger, and utilizing services like MyStrength and Calm. You've also seen a lot of different things on internal infrastructure building, ramping up mental health workers within existing systems. So I think this commitment to mental health and wellness for their own staff is very much there as employers of healthcare workers. Something that I think is also very tremendous is there's a company called Lytic out there that does remote monitoring. And during the pandemic, they built a solution that basically tracks, observes, monitors, and triages folks with COVID symptoms, essentially. And there have been employers and also healthcare systems adopting this to, one, not only manage their patient populations remotely that may have been exposed to COVID and track symptoms, but also their own workers, right? And so I know Lytic is partnering with KP Mid-Atlantic, and they've seen thousands of folks with really great outcomes, avoidable deaths even. And so if you look up the company, they have a lot of great stories around this. They're also working with folks like at grocery stores, which have, when you think of essential workers, right, of course healthcare comes to mind, but then there are a lot of other industries out there that are essential workers that we all are relying on. And so I think that is really tremendous work, and they're offering these solutions at cost for free. So that's another thing that I've seen from the innovation ecosystem. I think it's been tremendous. There's this company, Big Health, that offered their CBT solutions free, and folks like NHS supported their workers with that solution. So anyways, I think there's folks are doing a lot, employers are doing a lot around trying to support their workforce with not just mental health and wellness resources, but things that are for safeguarding for folks who may have essential job duties. And the other thing I'll just say too is technology is used in innovative ways. So Xanatos is this company that does environmental services, which is cleaning hospitals essentially, right? Super important right now. And certainly when you think about the scarcity of PPE, healthcare workers having to go into care settings and take care of folks, there's a lot of anxiety and stress, and so there's one, taking care of mentally, but then there's just tactical. So Xanatos, I love this example where they have patented X-ray technology, like ultraviolet rays cleaning essentially, and it's been used for one purpose for a very long time, but hospitals are repurposing that technology and using it to sterilize precious PPE for reuse, for like badges and Voicera, things that travel with people. So anyways, I think there's a lot of ways that people are being creative with their existing partnerships and innovation, and then new adoption as well.
Excellent. So Russ, are you seeing employers reaching out to you to provide their service to their employees?
Certainly. I think, I would split the employer space into two buckets. One bucket is an employer that is in an industry that's just really getting crushed right now by the pandemic, and it's hard for them to contemplate spending anything additional because they may not be around. And so it's a difficult part of the industry. They're having trouble providing core services, let alone additional services. Right. The other side are employers that I think recognize they're going to survive this, but their employees are under immense amounts of stress. We were seeing some survey results that show that 70% of people are crying at work right now. We're seeing that over 70% have said this is the most stressful moment of their entire career. We see people who have partners who have lost jobs, so they're feeling financial pressures. They're uncertain about their futures. They have kids at home that don't have care. They've got distance learning they're dealing with. So there are all these immense uncertainties and pressures, and employers are recognizing that for business continuity reasons, they have to provide support. Mm. It's no longer just an optional thing. They have to make sure employees have access to care. And that's where we're getting a lot of outreach from companies saying, hey, you're virtual, you're kind of designed for this moment. How can you help us make sure that people have 24/7 access to behavioral health services?
I just wanted to add too, the trend of, to win new customer business, employer business for payers, mental health and wellness is super important. And that has been the case actually, pre-pandemic. I think Ginger has great traction in the employer space with a lot of employers pre-pandemic as well. And it's because employers are focusing on this. A large percentage of Americans have depression, anxiety, substance use disorders, and these are employees, right? And so there was a shift in the marketplace where employers were starting to really cover these services as benefits for their employees. And then they were turning to their plans, their health plans, and saying, hey, I'm doing this for my employee. What are you doing around mental health and wellness for my employees? And picking what business they wanted to work with, in part based on these types of services. And so even pre-pandemic, you've seen payers moving towards, really elevating how important they think mental health and wellness is. And there's a business reason there. It's good for society, but there's also a business reason there. And now you're seeing even more of that, right? Which again, is why I think you've seen such acceleration and adoption from payers with these innovative players and all these announcements that have come out in the last few months.
Excellent. Yeah, is there anything pressing from the audience before we wrap up?
Yes. So yeah, we do have a couple of questions. So one of them, it's about, how do you support also, we have a number of executives on the calls. So how do you support management teams, in deploying those types of solutions inside the organization? And so what are the best practices that you see? Because I think, as you were mentioning, employees are going through stressful times. So what's the role of the manager in that situation, and what are the best practices that you see?
One of the things we've learned at Ginger is that you have to communicate to employees effectively. And part of that is helping to destigmatize what behavioral health is and help them understand what it is. So in other words, talking to employees about the specific stressors they face on a day-to-day basis versus saying, if you have a mental health need, use this. Talk about lack of sleep can lead to the following problems. here's how to improve your sleep. Talk about being a new parent can be anxiety driving and even depression driving. Here's a resource that can help, right? Talk to them about things that they're facing on a day-to-day basis. It also is extremely helpful to have an executive at the company that's highly respected, willing to talk about their behavioral health issues that they've dealt with. Be able to destigmatize this from the top down, because if employees see someone like that talking about it, they're far more willing to raise their hand and say, I have a need also.
Yeah, and I do have a last question that was asked, and it's about a topic of interest and concern for Orange, which is the digital divide. So a lot of the solutions that you described, and especially like telehealth works well if you have access to broadband access, broadband internet. How do you see, what happens for the people who don't have access to fast internet? What do you see? The market going?
I'll start, and I'm sure Shruti has some thoughts. One is, you don't need broadband to access Ginger. If you have access to a mobile device and the wide area networks, 4G, you can access Ginger. So if you can access Facebook, you can access Ginger. And I think increasingly services that need to move into these rural areas and ensure continuity have to think about how they're sending data, how they're managing the payload, so that you can provide these services with much lower bandwidth situations.
Yeah, Russ, this is exactly what I was going to say is like telehealth. I think when we think of like telehealth, virtual, these different things, we think of like the most cutting edge sort of thing, right? But it's really a phone call. It can be a text. It's really all encompassing. And so, I mean, there are some great, like Consejo Sano is an amazing company doing a lot of things with underserved populations in the U.S. That's all like it's text-based. And so there are a lot of great solutions out there taking care of populations in the States who don't have access either to, fast internet and things like that. But then also when we think of telehealth, really to be mindful of, it is the cutting edge remote monitoring continuous sort of thing, but then it is also simply a phone call or a text.
Right. Thank you. Thank you, Ron.
So just to close out the fireside chat session, just want to ask, since the majority of our audience is comprised of senior executives from around the world, what do you see is the one thing they could do right now to safeguard the physical or mental well-being of their employees during the pandemic and beyond? And Russ, I know you're going to say sign up for Ginger, but it's beyond sign up for Ginger.
Yeah.
Is there one thing you guys can think of? Give advice out there to the audience.
So my advice is, okay, these are unprecedented times. Everyone is dealing with so much stuff, and every day is new. Something new comes out every day, right? So all that to say, nobody has the answers, right? So if you are an executive, you manage large teams, the most you can really be is empathetic and communicate that you also are going through it. But the most important thing that you can do for your population is not think that you can solve it on your own. Is allocate the resources for the right expertise. So there's two things here. When you think of safeguarding, you think of physical and you think of like mental, essentially, right? Like for your workforce. So one, Russ, you don't have to say it, I'll say it. Partner with folks like Ginger for the mental side of it, who know what they're doing, who can get them the right resources. That's the best thing that you can do as a leader in your company, getting them the right resources. For the physical side of it, same thing. If you work in a space where your employees are at risk because they have to go in and be exposed and things like that, partner with folks like Validic. Make sure your employees feel safe doing these things. So I guess my answer in short is that don't be the one all be all solver and partner with people who know what they're doing.
I would add, tell your shareholders that you're not going to maximize profits right now. And make sure you're investing in your employees, because you'll come out of this period with a workforce that is far more able to accelerate, and you'll get those profits back later.
Thank you very much for that, guys. Partner with professionals, invest in employees. I think those are very great points to make to close out the fireside chat. So with that, if I could summarize a few points from the session today, they would be: the leash is really off on telemedicine. It looks like the momentum is real staying power, even in the next normal following the pandemic. 2, challenges facing the healthcare system as a result of the COVID present real opportunities for tech companies to engage with the industry in ways that were previously just unexplored or that are being accelerated currently. And 3, addressing mental health for yourself and your employees is incredibly important, now more so than ever. And fortunately, it's becoming more easier than ever to seek professional help. And this is a trend we'll hopefully see extend into the next normal. So I would like to end by talking briefly about X-Force, which is Orange Silicon Valley's corporate innovation program. If you're interested in the trends of Silicon Valley, or you're interested in partnering with or investing in startups, we'd really like you to be a part of the program. And you can, if you'd like to know more, feel free to reach out to my colleague David Martin or Ellen Crown for more information. And before we close, I just want to give you another special thank you to our guest speakers, Trudy and Russ, for sharing their experiences and insight with all of us and taking the time, quite frankly. And all my colleagues across Orange Business Services and Orange Silicon Valley that worked so hard together to make this happen. A big thank you to the audience who joined us live today and asking the questions. You really helped enrich the conversation. We look forward to connecting with you in the future. All my best to you as you navigate the next normal. Until next time, take care.